Miss Mimosa?
Yes.
Hi, Dylan Davies. I'll be your student in physical therapy today. How are you feeling?
I'm okay.
You okay?
Mm-hmm.
All right. So I'm going to be taking you through the subjective part of the exam, so basically just asking you questions and everything. After that, we're going to move into the objective part of the exam. We're going to be taking some measurements on you, okay?
Okay.
Do you have any questions for me?
Not right now.
Okay. Thank you for your patience out in the waiting room. This should probably take around an hour or so, but let's go ahead and get started, okay? All right, so first off, I'm just going to verify some information with you. How old are you?
I'm 29.
Okay, gotcha. And then during this process, I'm just going to be writing down some information, so if I'm looking down, that's why.
Okay.
Okay? All right. So, all right. Have you ever had physical therapy before?
No, but I've had OT for a fractured wrist.
Mm-hmm.
They did not know what they were doing because it still hurts.
Yeah.
Just hoping physical therapy is not like that because I want to get better.
Okay, yeah. So OT and PT are kind of similar in the aspect of the examination process and everything like that. But this PT is going to be some manual therapy, like massage and everything, and along with some exercise to kind of help you get back on the right road.
Okay.
Okay? All right, so let's go ahead and move on here. What do you do for a living?
I'm a customer service representative,
Mm-hmm.
so just answering calls and talking to rude people, trying to make them feel better.
Okay, gotcha. What does that physically entail?
A lot of sitting. Sometimes I get up to take myself away from the stupid people, but
Yeah,
a lot of sitting.
I agree with that. You gotta remove yourself from the situation sometimes
Definitely,
to
yeah.
calm down. All right. So how many hours in a typical workday for you?
Regular work week, 40.
Okay, gotcha. All right. So, what do you do for exercise?
I do Krav Maga. It's my thing. It helps me release my anger, and I just like hitting things. So.
Okay. So do you feel like you use that to release your anger?
Oh, definitely.
Yeah.
Yeah.
Okay. Have you ever thought of releasing your anger elsewhere?
Well, this is the first time I've ever not had Krav Maga, so I'm kind of like, I have this built up anger and I don't know what to do. So.
Okay.
I don't know what else to do right now.
Okay. You can probably talk about it with a psychiatrist if you go to one. Also, just kind of taking a step back and breathing, taking a little bit of a break.
I do need to
from
work
people.
on that. I definitely do.
Okay. All right. So what does Krav Maga typically entail physically?
It's kind of just like martial arts, self-defense. So, a lot of hitting, kicking, and all of that.
Okay. Gotcha. All right. So what other hobbies do you have outside of that?
Besides that and work, I like watching TV shows.
Mm-hmm.
Anything with vampires, I love.
Okay. Gotcha. What TV shows?
Vampire Diaries.
Okay. Yeah, I've heard of that. Is it any good?
Oh, I love it.
Yeah.
I definitely recommend it.
Avid fan?
Mm-hmm.
Okay, gotcha. All right. So, what is your living situation right now?
I live in an apartment.
Okay.
I live by myself.
Okay. Is that first story, second story apartment?
I live on the second story.
Okay,
so
so
I
you have
take
to go
stairs.
up and down the stairs?
Yep.
Okay, gotcha.
Every day.
Every day. All right. All right. So, what brings you in today?
So I'm having some hamstring pain.
Uh-huh.
I really want to get rid of this pain so I can get back to my Krav Maga.
Okay, gotcha. So, you kind of pointed out to that spot in your hamstring, your
Mm-hmm.
leg. Does it go anywhere else in the leg, either down the shin area or up the thigh?
No, it just stays right here.
Okay, just that one spot?
Mhm.
Okay. How would you describe that pain?
It's very tender. It's
Tender?
sore, kind of like a cramping, achy type of pain.
Okay. Do you ever experience like numbness or tingling on the leg?
No.
No? Okay. All right. So I'm going to get you to rate that pain that you're experiencing now. So what would you say your pain is currently?
A 6.
A 6? Okay. All right. And then what about when it's at its best?
A 4.
A 4? Okay. And then when it's at its worst?
A 12.
A 12?
Mhm.
Okay. So the pain rating scale is usually 0 to 10, 0 being, not bad at all, 10 being absolute worst pain that you experience. So it's your scale.
Mhm.
So with that in mind, do you still believe it's a 12 out of 10?
Well, yeah.
Okay. All right. And then on this body chart, I went ahead and filled out that area that you were talking about. Does that look correct to you?
Yeah. Yep. That area.
Gotcha. All right. So moving on here, what makes your pain worse?
Just walking around, going up my stairs also definitely makes it worse.
Okay. How long does that last usually, that pain that you experience after that?
For my walking? Or,
Yeah.
Probably about 15 minutes, just depending on how long I walk for.
Okay, and then the stairs?
Maybe like 10 minutes.
10 minutes? Okay. How does that affect your pain on that same scale, 0 to 10? Does it increase it?
Yeah. So, I mean, if I wasn't doing anything before, I'd probably go from like a 4 to a 7.
Okay, gotcha. All right. So what makes it feel better?
Just kind of doing that rice
Okay.
that the ER told me, so just resting it really.
Good.
Sometimes I take the Mobic medication that they gave me, so that helps.
Okay, good. So how does that help your pain when you're on that same pain scale?
It just goes back down to like the 4.
To a 4?
Mm-hmm.
So if it was at like a 6, it would go down to a 4?
Yes.
Okay, gotcha. All right, so next I'm just going to kind of ask some questions about your typical day and how you're feeling throughout it, okay?
Okay.
All right, so how is your pain in the morning?
It's not bad. It's just a little sore, but it's okay.
Okay, gotcha. How would you rate that?
Probably about a 3 or 4.
3 or 4? Okay. All right, and then how is your pain going throughout the day, like your work day and all that?
It jumps. It gets worse. The more I'm active or the more I'm doing, it just, gets close to that 12.
Okay, so more active, it gets closer to that 12 area. All right, and then how is your pain at night?
Sometimes it kind of bothers my sleep, but if I take that medication again or move positions, I can usually fall back to sleep.
Okay, gotcha. What medication is that helps you sleep?
That Mobic.
Mobic.
Mm-hmm.
Okay, gotcha. And how often do you take that?
Just kind of as needed.
Okay.
Yeah.
Gotcha. All right, and then next we're going to go through that medical form that you filled in before you came back here with me. So I see on here that you said yes that you use alcohol. How often do you do that?
I like my glass of wine every night. So.
Okay. Gotcha. I also see that you listed that you often get headaches. What usually precedes those?
Just being so angry and like the tension up here, it just kind of like radiates, and especially now lately, I can't let that anger out. So.
Okay, so more recently the headaches have gotten worse?
Yes.
Okay. I also see that you listed yes for having bipolar syndrome. How are you managing that?
I see my psychiatrist.
Okay.
So we're managing it.
Okay, good. All right. And then I also see on this form that you listed that you've had prior surgery. Was that the hand surgery
Mm-hmm.
you were talking
wrist.
about earlier? Okay, gotcha. Finally, you have on the form you listed that you have difficulty sleeping due to the pain. Kind of went over that already as well.
Mm-hmm.
With that, does changing the position usually get rid of the pain, or?
Yeah, the position or the medication.
Okay, the medication. Gotcha. All right. Have you had any x-rays done or MRIs done?
Yeah, when I went to the ER, they took an x-ray.
Okay.
But, I really don't see the point because I need an MRI. So,
Okay. All right.
I'm only here so I can get the MRI.
Okay. What did the x-ray say on it?
Negative.
It was negative?
Yeah.
Okay. Well, after this, we'll see what we'll be able to do about getting you that MRI.
Okay.
But we'll get there when we get there. And then for medication, I know that you talked about Mobic helping you sleep, and on your form you listed benzos and Lithobid. Are there any other medications that you need me to know about?
No, just those.
Okay. And for those other two, how often do you usually take those?
My benzodiazepine, just as needed when I feel anxious, and my litho, I'm supposed to be taking it twice a day, but I try to take it as often. I stick to that.
Okay, good. All right. So what caused your hamstring pain?
A week ago, I had a family gathering, and my nephew was just getting on my nerves. And so so one thing led to another, and I tried to kick him, but he walked away, and then I just felt a tear, and so.
Gotcha. All right. So, was it more of just a straight-on kick or to the side?
It was like a weird angle, like kind of out this way.
Okay.
I was trying to catch him as he was walking away.
Okay. Gotcha. So, and you said you felt like a tear happen?
Yeah. Mm-hmm.
Okay. Gotcha. Have you ever had any other injuries to the hamstring before?
No, I mean just soreness after like a heavy like Krav Maga day, but.
Okay. And then, are there any other injuries that I should worry about during the physical therapy process?
Just besides my wrist, it hurts.
Okay. Gotcha. So what do you expect to get out of physical therapy?
I really want to get back to my Krav Maga. I need something to let out my anger, and just to get this pain gone that way.
Okay. Yeah. Hopefully we'll be able to get you there soon.
Hope so.
All right. So with physical therapy, we, like I said prior, it's going to be some manual therapy and then also these exercises that will help you out. With those exercises, I'm going to have to teach them to you. So what is your best way to learn? Whether it be me demonstrating you, me showing you pictures, or just me telling you what to do?
Definitely demonstrating.
Demonstrating? Mm-hmm. Okay, awesome. All right, and then next part of the exam is just going to be the objective part, so I'm just going to take some measurements on you.